Drug allergy. A drug allergy is an abnormal reaction of the immune system to treatment. Every over-the-counter medication, prescription medication, or herbal it can trigger an allergy medication. However, an allergy to medications is most likely caused while taking certain medications. The most common symptoms of drug allergy are hives, rash, or fever. An allergy to medications can cause serious reactions, including a life-threatening condition that affects a number of body systems, anaphylaxis. An allergy to medications is not the same as a side effect of medications, it is a well-known potential in response to a medication label. Drug allergy is different from drug toxicity caused by drug overdose. Symptoms, signs and symptoms of a severe drug allergy often appear within an hour of taking the drug. In other responses, especially for acne, it can be for hours, days, or weeks. Signs and symptoms of a drug allergy may include skin rash, Instagram rash, itching, fever, edema, shortness of breath, wheezing, catarrh, itching, watery eyes. Anaphylaxis. Anaphylaxis is a rare, life-threatening reaction to the drug pet allergy, used to ensure a large-scale loss of performance of the human body system. On the signs and symptoms of anaphylaxis. Download: free respiratory tract, sore throat, causing difficulty breathing, nausea, abdominal cramps, vomiting or diarrhea, vertigo or dizziness, quiet, fast pulse rate, drop in blood pressure, attachment, loss of consciousness. Other terms and conditions as a result of a drug allergy. The drug is used less frequently, and allergic reactions may occur within a few days or weeks after administration of the drug and may persist for some time after discontinuation of the drug. These terms and conditions: serum sickness, which can cause fever, joint pain, skin rashes, fever, and nausea. Pharmacological anemia is a decrease in the number of red blood cells, which can lead to fatigue, irregular heartbeat, shortness of breath, and other symptoms. Drug rash with eosinophilia and systemic symptoms, dress, which can cause skin rashes, an increased number of white blood cells and general edema, swelling of the lymph glands, as well as for the recurrence of dormant hepatitis B virus infection. Nephritis, inflammation of the kidneys, which can cause fever, blood in the urine, general swelling, paralysis, and other symptoms. When to see a doctor, call 911 or an ambulance if you have symptoms of a serious reaction or suspect anaphylaxis after being given the drug. If you have milder symptoms of allergy to medications, you should see a doctor as soon as possible. Reasons a drug allergy occurs: when the immune system mistakenly identifies a drug as a harmful substance, such as a bacterium or virus. Once your immune system takes a drug as a harmful substance, it will allow you to develop antibodies specific to that drug. This can be done the first time the drug is needed, but sometimes an allergy occurs, does not develop until repeated exposure occurs. The next time you take a drug, these antibodies flag the drug and direct an immune attack on the compound. The chemicals released by this activity are the cause of the symptoms associated with an allergic reaction to it. Although you may not be aware of it, your first action is on the drug. Some evidence suggests that trace amounts of the drug in food, such as antibiotics, may be good enough for the immune system to produce antibodies to it. Some allergic reactions may be due to another process. Scientists believe that certain medications have the ability to communicate directly with a specific type of white blood cell in the immune system, called T cells. In this case, in turn, there is a release of chemicals that cause an allergic reaction after the first injection of the drug. Medications are often associated with allergies. Although any drug can cause an allergic reaction, some medications are usually associated with allergies. These include antibiotics such as penicillin, painkillers such as aspirin, ibuprofen, Advil, Motrin IB, and naproxen sodium, Aleve, drugs used in chemotherapy and cancer treatment, medications used to treat autoimmune diseases such as rheumatoid arthritis, non-allergic medications. Answers: sometimes this reaction to the drug can cause symptoms almost the same as in the case of a drug allergy, but it is the drug reaction that is not due to the activity of the immune system. This condition is called a non-allergic reaction or a pseudoallergic drug reaction. For drugs that are more likely to be associated with this disease, these include aspirin dyes used in imaging studies, radio contrast environments, opioids for pain management, local anesthetics. Risk factors: while everyone can have an allergic reaction to the drug, there are several factors that can increase your risk. These include: there is a history of other types of allergies, such as food allergies or hay fever. Personal or family history of drug allergies. Increased exposure to the drug, such as high doses, repeated or prolonged use, some allergy-related diseases, such as HIV infection, or Epstein-Barr virus. Prevention. If you are allergic to medications, the best prevention is to avoid problems with the medication. Steps you can take to protect yourself include the following. Inform the ambulance service. Make sure that drug allergies are well documented in your medical records. Inform other health professionals, including a dentist or healthcare professional. Wearing a blindfold. Wear a medical notification bracelet that notifies you that you are allergic to medications. With this information, you can provide appropriate treatment in case of an emergency.